Good afternoon to everyone. Thank you for joining us for today's webinar, 6 Degrees of Separation, Understanding the Importance of Social Networks Among Aging Adults. My name is Rachel Logan, the Training and Technical Assistance Manager at the National Center for Health and the Aging, and we are joined today by 3 amazing speakers who will share more information about social networks in older adult populations. Our first presenter is Ms. Emily Dessum, who is the Senior Program Manager at the National Council on Aging. Since joining NCOA in 2008, Emily has been integrally involved in researching and disseminating promising practices in evidence-based programming. We will then hear from Ms. Ileana Welch, who is the Chief Marketing Officer of Big White Wall and has 30 years of executive leadership experience in business development, marketing, of healthcare services, technology, and software, and is also a clinician with a postgraduate education in geriatric care management. Last but not least, we will hear from Ms. Amy Ohm, who is the founder and CEO of Treatment Diaries, which is an online patient community built at the intersection of personal health, privacy, and social communication. Here at the National Center for Health and the Aging, we provide training and technical assistance to health centers who serve low-income senior populations. We do this in various forms, including like today's webinar, as well as manuals, toolkits, and other resources. After today's webinar, attendees will have the tools to understand how social media and social networks can connect older adults, learn how social media and social networks relate to overall health and wellness, as well as list 2 innovative ways social media is helping older adults. I would also like to remind all attendees that the webinar recording will be made available on our website following the webinar. I'll go ahead and pass it off to Ms. Dessum.
While we're working on the slides, I can just tell you a little bit about the organization I come from. So I'm from the National Council on Aging, and we're a nonprofit service and advocacy organization representing older adults and the community organizations that serve them. And our mission is to improve the lives of millions of older adults, especially those who are vulnerable and disadvantaged. So just a little background specifically around older adults and social networks. Research has shown that social interaction of any type offers older adults many benefits. Staying socially active and maintaining interpersonal relationships can help you maintain good physical and emotional health and also cognitive function. And people who continue to maintain close friendships and find other ways to interact socially live longer than those who become isolated, and relationships and social interactions can even protect against illness by boosting the immune system. So next slide. So staying socially active and maintaining relationships are obviously important parts of healthy aging. It's very important for older adults to reach out to their loved ones, neighbors, friends, family members, and stay vibrant, active, and social. And older adults can do that by staying in touch with family and friends and trying to visit them regularly. And there are some other ways that we can really encourage older adults to maintain a high level of social interaction. Volunteering in the community, visiting a senior center. Every community will have great senior centers that offer activities with other seniors, which is a great way to make new friends. They can join groups focused on activities they enjoy, taking a class, maybe learning a new language, new style of cooking, or experimenting with a new hobby, joining the gym or fitness center, and many senior centers also offer fitness classes, so that's another great way. It's important to stay out of the house, I think, so scheduling regular visits with grandkids, volunteering at a school or a children's organization is always helpful. And so staying in touch in person is really important, but another great way to stay socially connected is through the internet and online social networks. And I think that there are a lot of myths out there about older adults and technology use. So let's dive a little bit more into the reality. So next slide. So a new report just recently came out from the Pew Research Internet Project that really sheds light on older adults' habits when using the internet, cell phones, devices, social media, and other technologies. And this information can really help you shape your strategies and ideas for reaching seniors. While older adults in America have historically been late adopters to the world of technology compared to younger adults, their movement into digital life continues to deepen, according to this report. And the key findings include that 6 of 10 seniors now go online, and just under half are broadband adopters. There are some challenges and hurdles, I think, that older adults face when adopting new technologies. Physical challenges can be one, skeptical attitudes, and also the difficulty of learning new technology. But despite some of these unique challenges facing the older adult population, most seniors who become internet users make visiting the digital world a regular occurrence. Once seniors join the online world, digital technology often becomes an integral part of their daily lives. One more thing that came out of the study is that seniors do differ from the general population in their device ownership habits. Smartphone ownership is fairly low among the entire age spectrum of the older adult population. 27% of older adults use social networking sites such as Facebook. And as is the case in the online population as a whole, older women are more likely than older men to use social sites. And half of female internet users ages 65 plus are social network site adopters, compared with only 40% of older men. And older adults who do go online have very positive attitudes towards the internet. Almost 80% of older adults who use the internet agree with the statement, people without internet access are at a real disadvantage because of all the information they might be missing. And 94% agree with the statement that the internet makes it much easier to find information today than in the past. So for a variety of reasons, which could be mobility, physical distance from family members, some older adults have difficulty connecting with friends or family members in person. And for these seniors, social networking sites can offer an additional venue for connecting and socializing with others. And older adults who use social networking sites are more likely to regularly socialize with friends, whether online, in person, or over the telephone, compared with seniors who are not social networking site users. 81% of older adults who use social networking sites say they socialize with others on a daily or near daily basis. So with that background, I'm going to turn it over to another speaker who will share another innovative way people can connect online. And I'll turn it over to Big White Wall.
Good afternoon. Big White Wall is a social networking site that incorporates strategies to assist people with mental health issues or to assist people to develop resilience around daily stress and those types of things. Our primary audience is aged typically from 35 to 60, but over the past couple of years now, we've been sponsoring the community since 2009. Over the past couple of years, we've seen a significant increase in the membership of people over the age of 65. The Big White Wall has several different levels of intervention, and what you're looking at now is one of those types of therapies that people participate in our community, which is built around art therapy techniques, and where they come in and they create their own bricks. And these bricks become part of Big White Wall. So the name Big White Wall is based on the early history of the company, which the company started in the UK, and part of dealing in social communities in the UK are these big areas of housing that are sponsored and have people who live below certain income levels. And in that, in one of the neighborhoods, they were demolishing one of the larger communities that had been there for 30 years to replace it with newer housing, and there was a large mass of people that had to leave their homes. And so the founder of Big White Wall created an opportunity. We went through and whitewashed the walls and allowed people to express their feelings about losing their homes and having to relocate themselves, the cultures and friendships they have built, hence the name and the bricks. The idea of Big White Wall is to take social networking principles, and when we mean that, we don't necessarily refer to Facebook and Twitter and those types of things, although they're component parts of the way that we work with people. But we think about it more about joining people together so that they can create their own content and share content. And so we have a professionally managed community for people who are experiencing poor mental health and well-being. We have a 24/7 service, which is safe and anonymous, and online, and we moderate that 24/7 with a set of professionals called wall guides. We have a UK and a US-based community. We use evidence-based peer and clinical support, so we're integrated into the health systems in which we work, which in the UK is the NHS, and in the US we're working with larger health plans. Underneath the system, because in these kinds of situations, when you have people interacting in peer-based communities, you worry about their safety. We have underlying technology that monitors for danger words and other types of behavior. And the community is now robust at about 24,000 people with a building community in the United States. We have 2 separate communities, one based in the UK and Europe and one based in the US. So we also are part of a virtual extension of community and care organizations, and those would include health plans and other health providers in the countries that we work in. Our interfaces, our interventions available with many different types of interfaces. You can see 3 here pictured on the screen. And we find in the older populations that the tablet-based solutions are the ones that are most popular given the size of the screen, the blocking that we can use to address people that might have issues with disability or dexterity, and people can interact with the various levels and then maintain their connection to the community. Next slide, please. So what we find with the elderly populations in particular, that this is a way to really solve some of the issues around social isolation. The ability to find like-minded people within the site themselves is also critically important, especially for the older populations with chronic illnesses or multiple chronic illnesses. They can build communications and support groups within the site around those particular conditions, and we find that in many cases it significantly cuts down on their use of other types of services like the emergency room, and because we're available 24/7 and they can access somebody online all the time in terms of breaking that social isolation that Emily referred to. So here's a typical screen, and this is, as I said, the service is anonymous, and everybody has a username that's not a recognizable name of any kind. We monitor for that as well. And what you're looking here is at the home page where somebody comes in, they can express the mood and how they're feeling that particular day, and we track those. And over the last 20 years of working in geriatric care management, how are you feeling is one of the guiding principles in really getting somebody to think about where they're at in their journey. In this area as well, they can access other people by using this block here with tags in it. They can find people who've made bricks with similar feelings, and in the community areas we have forums, which we call talkabouts, where people can join each other. They can post their ideas, all of this, and their feelings. All of this is monitored 24/7 by our wall guides. So in this particular case, you can see also a place where they're monitoring, where we have about 14 different assessments that are in our useful stuff area, which is content and assessments that people can take, which give them some idea of where they're at and provide them with resources to help them deal with those things. But the primary thing here in this community, which has driven really the success of the site over the years, is this ability to connect with other people who are like-minded, to share ideas and stories, to reduce that sense of isolation, to remove the stigma associated with a mental illness or a mental condition. And this is a really important component. Could you advance the slide, please? So I think that the key thing to consider in terms of the concept of merging social networking principles with clinical oversight, which is part of what we do, is to really understand the journey that people take as they work to achieve well-being, especially in the elderly populations where their mobility might be difficult. They don't have access to transportation. They need to be able to access support. We have several different levels that we use in the social network environment. And these are explained on the screen here. They can be referred in by their doctor or a psychotherapist or any other type of clinician, and they can self-refer. As I said, they can go through an assessment process to determine where they're at in their journey. What we try to do is encourage people to express themselves using the social network principles to create the content, to build the bricks, to start their talkabouts, and to connect and make connections to people who can support them. We have an area where they can interact with one another around self-paced courses around anxiety and depression, mindfulness, smoking cessation, a number of different things, and the social networking principles really add to the engagement there because people can interact with each other in the wall guides where they're going through those courses. And at the top level, people can actually turn on a HIPAA-compliant, secure connection to a therapist or another resource if they feel like they should need additional support. And those therapists are generally supplied by the health plans or Medicaid providers across the United States to address licensing issues. We have about 4 years of outcomes now where we demonstrate high satisfaction, good cost savings, reduction in isolation, certainly a tremendous impact on people's levels of depression and anxiety through the intervention. Could you change the slide, please? But what we're finding in the older community now, as people are aging, the baby boomers age into the 65-plus areas, is that the usage of technology has really changed. Since I started 20 years ago in geriatric care management, that the adoption of these types of interventions and interactions that are purely 100% online is quite high, and as long as the interface maps to the person's capability to use the technology, that we find that people are not having any difficulty at all adopting to using this type of technology. So thanks very much for listening. This last slide just gives some connections to people and recent awards, and I appreciate the time to talk to everybody.
Thank you to everyone for being very patient with us as we try to figure out the technical difficulties. Because we do still have Ms. Amy Ohm from Treatment Diaries, we will go ahead and start with her presentation shortly.
Well, thank you for the opportunity. I've been looking forward to this. So I wanted to just start with, social media in general and talking about how it's quickly bringing people closer to the center of their care, and certainly providing tremendous empowerment. Knowledge about health continues to be the most popular topic on the internet. People want to learn more specifics when it comes to a particular ailment, the treatment, the symptom, the diagnosis, the list is long. But what they don't need is more information. So if you want the truth, it's captured in the personal stories of individuals living with a health-related challenge. So you may not know this, that there's over 4 billion searches occurring every day for tens of thousands of health-related topics. How do you find and connect socially with someone who's living with, whether it's desmoid tumors, scleroderma, ITP, a form of cancer? What if you were an individual who had all of these ailments? Could you Google it? Yes, you could, but you'd find a number of links to various information sources about these conditions. It's really the needle in the haystack, that person with all of these conditions, and it's nearly impossible to find. So as a result, some of the attributes which make these connections on treatment diaries valuable include the fact that, as the aging population evolves, there's a growing number of health-related challenges, there's complexity of needs, there's the management of multiple diagnoses, there's the fact that we're living longer with chronic illnesses and the need for increased support, and certainly a growing demand around virtual support, which is what the social aspect brings to the discussion. So people join treatment diaries for a number of reasons, but primarily because they want to be private about their thoughts and connected to those who can help. Many of our users are, venting about doctors not having sufficient time and compassion for those with chronic illness in the aging population, families who have grown tired of their medical condition, and friends who have disappeared. These real-life scenarios make online connections and family central to the daily needs for encouragement, treatment insight, and support. So when you look at who's actually utilizing a site like treatment diaries or leaning on social media, they span a number of different demographics and ailments. Certainly, our dedication is to the needs of all types of users, so whether it's the aging population consistent of individual patients, their caregivers, family members, and advocates, we advocate for the importance of keeping a diary of life-changing experiences and the significance of engaging in behaviors and those activities which promote health, mental wellness, and self-management of all medical conditions. So it's really a different kind of social, to be unknown as a person but known through your illness. Treatment diaries is providing a real information exchange between actual people coping with or caring for anyone with, whether it's a chronic illness, mental health condition, rare disease, or life-changing experience. So we're very much focused on filling that everyday need of those learning to cope with life, with a condition, those things that never go away that may seem incredibly challenging. It's certainly a community of people who understand exactly what you're going through because they share your illness and who become inspired by helping others get to the day, even if they don't feel well. So we're certainly facilitating that connection on behalf of all the users. To those who don't know you physically but who share your experience across any and all medical conditions and with complete anonymity. So I'm going to share just an experience or scenario that typically occurs. My slides are not advancing. Let's see. I'm hitting page down. Let's see if I do this. So if you're newly diagnosed, you might first go to or traditionally go to, say, Google to find information. For those living with and caring for this illness, a traditional search will yield what you see here in front of you, and that's clinical insights, pictures, a lot of nonprofits. What's missing is the actual patient story. So what's different about treatment diaries is you can search all the diaries on the same term, but you're going to find those personal stories, those individuals who are going through and understand that diagnosis in the form of actual diaries. So these individuals are going to write about their experience with a diagnosis and really chronicle what they've gone through in order to address it, what some of their fears are, where they're at with it. And then the users can then interact with one another. So either add to that diary experience with personal experience, show ways of encouragement by virtue of just uplifting comments and input. But the anonymity extends the freedom to be completely open with your concerns. So those fears and interests can be expressed without worry. Living with illness and providing care for loved ones can be incredibly isolating. So people always feel better when they can share, especially when it's private, and even more importantly, when they can share with those who can relate. So I would say, having a personal diagnosis, I think, and there's probably those of you on the call that can relate as well, family and friends always have good intentions, but they often lack understanding and experience for those of us on a journey with aging, with illness. Too often these physical circles can wear thin because sometimes people grow tired of hearing that you're not well. So the social connections are incredibly important, and the anonymity provides lasting qualities. And you don't have to, quote unquote, know someone physically to understand and relate to and share to make others feel better. So the same applies to researching a treatment. So post-diagnosis, you might be presented with, here's how we're going to treat that. Again, I might go to Google and search it. I'm going to see drug disclaimers, a lot of clinical insight, FDA mandates, a lot of scary stuff typically. But what I really want to know is how actual people are navigating this illness when they take a particular or are going through a particular treatment. So treatment diaries gives that page or that view, that story of what it's actually like to navigate that treatment. And we believe that support is almost always best when provided by a peer. So someone who shares the condition, who has firsthand perspective on navigating an illness and coping day to day. To connect with someone on a similar journey provides that encouragement and perspective and helps one feel much less alone. And you don't have to explain yourself to someone who can understand and relate because they already know. They can anticipate your needs and definitely relate to your emotions. So the last example I'll give is really along the lines of a rare condition because that's pretty typical. And unfortunately, in the world of rare conditions, there's not always the ready supports or infrastructure to give to those individuals navigating this type of an illness. And so, again, I might go to Google and I'm going to find a lot of information, but not a lot of people or actual stories. And with treatment diaries, much like the other scenarios, we're going to offer that intimate experience, that individual who actually is navigating that rare disease and who can share their specific insight and connect with you on how they're coping. So many turn to the privacy that we offer in treatment diaries and those with actual experience as a way to share a lot of their unspeakable fears and connect with those who can relate and provide actual insight. So in summary, everyone has a story. It certainly doesn't have to be a challenging health-related story. I think as we evolve as a population, especially from an aging perspective, we need support. And personal accounts of survival, of journeys with treatment and caring for others draws people together. People clearly want to help people, and certainly those that are helping are enabled by those that they're assisting. Reading, sharing, knowing that you're not the only one struggling builds bonds. We're bringing, from a social perspective, we feel like we're bringing significant value to the person, the patient, the caregiver, the family member, and in many cases, helping them to remain compliant with treatment and just feeling better about life. So this is a unique platform. We hope and we're thankful for the opportunity to share it. We're very passionate about social, especially as it relates to health. This platform is for everyone, so any illness and any kind of role in a patient's life, and participation at any level, so you can come to read, search, scribble, interact with the diaries of others. There are no restrictions as to how much or how little you share. There's no forms to fill out. There's nothing that identifies you publicly. So in essence, your secrets are safe with us. Your well-being is our primary interest. We care about connecting you to great people and resources, and we want you to feel well despite your age or an illness, and to be empowered by helping others while growing through the knowledge and experience of those who share your condition. So living with an illness doesn't have to be isolating, and being social doesn't always have to be public. And connections empower everyone to be healthy. So thank you very much.
Thank you so much for your presentation, and to all of our presenters, thank you again. Despite technical difficulties, we really appreciate the information that you were able to share with us. Now we'll go ahead and open it up for Q&A, and I would like to highly recommend that our attendees use this opportunity to ask some questions, since this is more of a unconventional way of delivering services and connecting with your older adult patients. Ask questions and see how you can get more information about how you can institute or implement these types of services and programs at your own health center or wherever you work. If you do need to ask a question, please use your panel to the right, the GoToWebinar panel, to type in your question, and I'll forward that over to the presenters. And then you either can use the raise your hand icon or just type it in, and we'll get that over there to them. In the meantime, while I wait for questions to develop in the queue, just a few announcements and housekeeping things. Visit our website in order to get the recording and the slides from this presentation if you want to use it as a resource later on. We also have additional resources and information on our website. Also, join our mailing list to receive information about upcoming webinars, HRSA updates, as well as funding opportunities and other senior programs. And then follow us on social media. We use that as a way to disseminate quick information and also to incorporate the senior population in the social media realm and world. And then just noting past events, thank you to anyone who was able to attend our 2014 National Primary Care Symposium on Aging. Those resources and recordings will be made available on our webpage in about 2 weeks. So I just recommend that you check back for that. And then, of course, feel free to contact anyone at the National Center for Health and the Aging in order to assist you with any questions or concerns you may have. So first question, can you, and I think this is for Big White Wall, can you better explain Medicaid reimbursement through the services offered on Big White Wall?
So that's a really good question. So we have several programs that are running and each of them is positioned a little differently based on the payer. So through a managed behavioral health system or provider, we have population-based programs that are running that are, based on populations that might be 100,000 people with certain, generally speaking in Medicaid, we're dealing with mild to moderate depression and anxiety, while we also have the capability to address populations with serious mental illness. This is really an access issue for Medicaid in terms of being able to provide people with some level of service, even if they don't tick the box for a face-to-face type of intervention with a clinician right off the bat. So we have a lower price type of population-based approach that generally the Medicaid providers take, as opposed to a per engaged member per month. Okay. Hopefully that answers the question.
Yeah, thank you for that. And just as a question to the panel, are you aware of any health systems that were able to incorporate similar features from social media or some of the platforms that you displayed today in their patient portals?
Amy might be able to answer that one too.
Okay.
I can, but
oops, sorry, I was on mute. Talking to myself. I apologize. You know how that goes. So specifically with treatment diaries, that's actually one way in which we're leveraged as it relates to existing platforms. So with platforms like the Get Well network, which is a patient-centered platform deployed across hospitals, where it's really a way for the patient to keep track of how they're feeling when they're going through treatment or in the hospital before they're actually discharged. And one attribute of it, and it's actually a fabulous platform, but one way in which they engage the patient to help them align themselves socially post-discharge is to incorporate treatment diaries as part of their platform. And it's a way in which we're growing significantly, just working with others cooperatively versus in a competitive manner. And I think, there's a lot of ways in which the marketplace sees a need to be social, and it seems like everyone's looking at it a little bit differently and giving the market an opportunity to embrace a lot of different scenarios. So we're definitely seeing that.
Great. And Ileana, do you have some comments as well?
I would agree with Amy's and just say that I think what we're seeing is health plans that have deployed different types of interventions around strategies to address their behavioral health populations. New regulations, the Mental Health Parity Act, various things have driven a different behavior in health plans in the United States in terms of being able to offer these types of services to help their populations develop coping skills to provide added benefits to members. So we see many of the major health plans incorporating some types of these types of support services into their portal strategies.
Okay. Very good. Yeah, I feel like it'll become more common as older adults continue to participate in such technologies. And just on a side note, what is the average age of the user on Big White Wall or on the other platform that Amy presented, Treatment Diaries?
Our oldest participant right now is 93. Our youngest is 13, we think. And our average is about 53, 54.
Okay, excellent.
So we have a similar spread. We restrict the use to people over the age of 18 because people under the age of 18 require a much different type of safeguarding. The bulk of our users or members are in the, I would say, the 35 to 55 range, but we have a growing percentage of that 24,000 people, more than 15% now who are over the age of 65. And I can't tell you the actual age of the oldest user because we don't ask them that, but we do have quite a percentage over the age of 65. We ask for a range of age.
Okay, excellent. And for some of the services that are offered through your sites or the information that's available, how do you refer or get people the information that they need if it's not available on your site?
Is that to Big White Wall or to Amy?
I guess
you take that one.
Okay. So in the area that I described called guided support, so we have an area that is useful stuff, which is a collection of curated content, and some of it's actually developed by the Big White Wall content teams. We provide a range of topics for people to address. We also allow the members to create their own content in the form of those bricks and the talkabouts and those types of things. And we moderate that content as they put it up, of course, for the danger areas that I described. And then we have the guided support area where we actually integrate curated content from, it could be one of the health plans we work with because they've, in many cases, the health plans have developed their own type of content. We have Medicaid community mental health centers that have content. So in that area, people can put in their own content once we've curated it for views. So we try to keep people within the site as much as we can and bring the content into them, and that way we can be sure of their safety.
Yeah.
So we take a little bit of a different approach, but similar in that we do provide resources based on condition. So we align the approved resources with their diagnosis and their geography by which they're joining us from. So we look at when they log on their IP address and identify what resources matter based on where they're located. And then we make sure that they're specific and carefully chosen to align with the conditions that they're navigating.
Okay, great. Yeah, so two different strategies, but very effective in connecting older adults with information and other patients who need it. So this question is for Emily. What other technologies is NCOA working with right now that is very senior-centric, that kind of fits into this new push to put things online and have older adults engaged through social media and social networks?
I think the biggest one is actually we have a version of the Chronic Disease Self-Management Program, which is a self-management program for people with multiple chronic conditions. And we do have an online version of that where people can participate in the workshops online and go through a program where they are in a group and they have a moderator and talk about how to self-manage their chronic conditions. We also have a specific version of that for diabetes and for cancer survivors as well as for caregivers. So that's really what we've been working with, and that's really something we're still testing, I think, but have been playing with that, and we've seen it's been interesting. We've definitely seen that same program is also offered in the community, and we've seen higher enrollments online than in the community, which I think speaks to how much older adults are online. So we don't always think they are.
And also for information and for, grantees or health centers or healthcare providers who need some stats or some research-based information on older adults in the online community, are they able to go to the NCOA website, or where would they be able to find that information?
Absolutely. We definitely have information on our website. I also think the Pew research study, and if you just do Pew Internet Research, PEW, they have a lot of great resources and do a survey of older adults and how they are using the Internet and how it's changing over time.
Oh, excellent. And I think that was my next question is kind of for each of you, kind of describing where you see older adults headed in their connection with social media. Where do you see healthcare delivery headed as it relates to older adults accessing and using social media and online communities more?
This is Emily. I can dive in first. I think one of the most exciting things about these social networks, and especially online, is the ability to reach populations we might not have been able to reach in the past, and the ability to connect people. I think that both Amy and Ileana's platforms show a great way that people can be connected all over the world, really, and be able to talk and share and get support that they might not have otherwise gotten. And I see it moving into rural areas. I just see it being a great way to connect some of the people who might have been socially isolated in the past.
Great.
I would agree. I also think it's great insight for the healthcare marketplace and investing time and understanding how these folks interact socially as a way to better treat them in person. So often, especially in the, the senior community, it's very difficult to articulate what you might actually be feeling and going through, and to acknowledge that you might not be well. And, we have a number of healthcare advocates who have given us feedback on the impact of reading these personal stories and being able to identify with those things that they suspected might be occurring but that the patient wasn't sharing. So it allows them to more proactively treat, to improve their bedside manner, to connect with the patient on a very different level when they see them in person.
Great. Is it possible to kind of speculate as to how other diverse populations, as the older adults continue to diversify as the population changes, we have this, rise in the ethnic and racial minorities. How do the services and information that you guys are providing to the older adult communities, how is that going to change, and do you have those systems already built in to kind of relate to non-English speaking persons?
Yeah, that's a tough one. We definitely have a global user base. I think Google does us some favors by way of helping the users translate on their own as far as site specifics, and serving up actual resource-related items. That's a very different challenge and one that we are working on. But we have a large majority of our population is U.S.-based, followed by the UK and Canada. So a lot of English-speaking individuals, but a growing focus on the Latino community. So you're right, it's a challenge, so we're working on it.
Okay, great.
Good white wall. Our next version is a Spanish speaking version. It's not difficult for people to post in different languages, but the key issue is maintaining safety and those types of things, and being able to connect the vibrancy of the community through the different levels requires considerable effort. So we're working on the Spanish versions for the various areas that we're working in. And, again, there's not just one version of Spanish. So,
yeah.
It has to be culturally sensitive, which makes it a challenge.
Yeah, thanks. Our last question. If an organization decides to promote one of these platforms, is there a way to receive the data on the number of new users within a certain region? I know protecting anonymity is important, but this data could be helpful to the health system. So that's either one.
In the interaction, so we have aggregate data on the population that we collect, and we do collect, even though it's an anonymous site, we do collect quite a bit of information from the health perspective. If in fact, and we know where people are coming from, so we can provide that data as well. We always allow the members to make the decision about whether or not they want to share more data with the health plan. And for the most part, we find, especially in social networks, we find a great willingness to share their data and to pass it on. So we do provide as much as we can via just reporting, or we do integrations with various EHR and EMRs, but it's really up to the patient or the member in terms of the more specific data related to themselves.
Okay, great. And let's see. Okay, so yes, that ends the Q&A session for today. But once again, I would like to thank all of our presenters for the information that they shared. It was very informative, very interesting, and now we all have to figure out how we reach the populations we serve through the continued use of online networks, social media, and these new technologies that are out there that target vulnerable populations. So I just want to thank you all again. Thank you to our attendees, and you can check for the recorded version as well as the slides on our webpage in about 48 hours. Thank you, everyone, and have a good day.
Thank you.
Thank
Bye.
you.